A substance commonly used as a sugar substitute can be toxic to dogs. Dr. Amy Guernsey with University Veterinary Care Center is joining us for today's pet advice. We're talking xylitol toxicity. Good morning, Dr. Guernsey.
Good morning.
Well, let's start with the basics. What is xylitol and where is it found?
So xylitol is technically a sugar alcohol. It's most commonly used as a replacement for sugar. We'll see it most commonly in sugar-free gums. We're starting to see it more in some of the, what I call it, the hipster peanut butters, the nut butters, as an artificial sweetener. But because it does have kind of a cooling effect and kind of has a moisturizing property to it, it's found in a lot of mouthwashes, some over-the-counter human medications, and now we're starting to see it in deodorants and even some facial products like face wipes.
Well, dogs like to get into everything. So what kind of problems can it cause if a dog does ingest xylitol?
The two main issues are that the dog's body doesn't recognize it for what it is. When a dog ingests xylitol, the body gets the signal that they just ate a bunch of glucose, which they didn't. So there's a huge release of insulin, which causes them to actually end up with low blood sugar and low potassium levels, and in severe cases can actually cause liver damage.
Now, if we know our dog ingested something with xylitol, what symptoms should we be watching for?
Well, you don't want it to get to the symptom point. If you know they ate a pack of gum or they ate a bar of deodorant or something crazy like that, the first thing to do is to contact your veterinarian. If we can decontaminate by getting them to vomit and do some activated charcoal or something, then hopefully they don't progress into symptoms. But if you get home from work and you see wrappers everywhere and your dog is lethargic, vomiting, having tremors, seizures is a really bad sign, any of those things out of the norm, you need to contact your veterinarian.
Can it be treated? I mean, you just mentioned that you really don't want it to get to the point where you notice symptoms in your dog.
Right. So there's no antidote for xylitol. It's supportive care. Lots of IV fluids, trying to get their blood sugar normalized, liver protectant medications, and hopefully getting them through that episode. Generally has a pretty good prognosis if caught early, but if they've got a really big dose and it's been untreated for a long time, those are the cases that don't end up as nice.
All right, Dr. Guernsey, thank you so much for being with us today. And for more information about University Veterinary Care Center, head over to universityvetcare.com.